We think it's important that
children, kids,
young people, whatever you want to call us, have a voice.
This is Kids Talk, where we the kids ask the questions and you give the answers.
We have some questions for the important people who are responsible for the health and well-being of young people in Newham. Let's meet them.
Hi, what's your name?
Hi, my name's Jason Strelitz. I'm Director of Public Health in the London Borough of Newham.
What do you do?
I work with all parts of the borough, with the NHS, with the council, with schools, with police.
What's the aim of your job?
We try and improve the health of people of all age throughout the borough.
Hello, who are you? Oh, don't tell me, you're a nurse.
My name's Leah. I'm a staff nurse from Rainbow Ward at Newham University Hospital.
So, Leah's a nurse. What's your name and what do you do?
So my name is Dr. Vyas. I'm one of the A&E doctors at Newham University Hospital.
Last but not least, who are you?
My name is Geetha Subramanian Mooney. I'm the Corporate Director for Brighter Futures, Newham's Children and Young People's Commissioner.
What's it been like during the whole lockdown thing?
The COVID crisis has been absolutely unprecedented. I think it's been really challenging for a lot of our families. It's certainly been very challenging for people who are working.
Leah, what's it been like at the hospital?
It's been really difficult, obviously, having to get dressed up in the PPE and, looking after patients when you haven't kind of got that friendly face anymore, when you're covered by the mask and the goggles and the gowns.
How do you manage?
You've just got to try and be as friendly as you can with your words and just really try and overcompensate.
Do you have a special trick for that?
I like offering tea and biscuits and other things that I can give them.
I love tea and biscuits.
Especially Oreos.
So, Leah, lots of people weren't going to the hospital. Why?
People are scared. People are scared of catching coronavirus. They're scared of all the things that you see on the news that they may have even heard happening to their own family and friends.
Scared?
Yeah.
What would you say to them?
Your child's health is more important than anything else, and of course there is certain risks, but you've also got to think about the health of your child.
What's up, Doc? How are you looking after people when they come to see you?
We are treating corona patients and non-corona patients separately. So please do come into the A&E department if you're worried about your child or if you're a child.
How can people know they're safe?
We are very particular in the A&E department about managing our patients, and we will give you the best care we can. We will treat you as well as we would have done before the virus.
So Geetha, what has the council been doing about corona?
What we've tried to do in Newham is to think about a whole system, about how we engage with our communities in the response, how we think about all of the different aspects that are affecting families and young people.
Any examples you can tell us about?
And we've had health visitors who have been working with our families through this time. We've had children's centres that have been opened so that families and young people can be supported. And we are clearly working through schools and other avenues of the voluntary and community sector so that we can continuously send messages of reassurance, of support, guidance and advice, and really being there when families need us most.
Jason, we haven't spoken to you for a while. What's the main message you're going to everyone?
What we're saying to people now is it's so important, if you're concerned about your health or the health of your children, to access the NHS, go to A&E if it's an emergency. It's really important.
Lots of us are going back to school because things have improved. What more is there left to do?
The situation with COVID has got so much better because of the efforts everyone's made, and we all need to continue looking after each other through this next phase of the pandemic.
In what way?
In every possible way we can think of.
Okay, Geetha. Mental health is something people are talking about quite a lot. What do you say about this topic?
The mental health of young people, not least in the horrid COVID times that we've seen, is going to be very, very challenging. Young people have been exposed and immersed in things that they really shouldn't have in their young lives, not least to be hearing about death constantly and also to be seeing a world around them of which is very uncertain.
What can you do about this?
The council, its partners and particularly myself, we have a really, really important role to make sure that we constantly reflect on that and that we think about what more do children and families need to help them to have a space to talk, a space for them to reflect about their emotions and experiences, and a place in which we can help them to come out the other side.
I think we have taken quite a lot of your time. Any final words?
Children and young people need adults more than ever before. Adults are here to keep children and young people safe, to allow them to be children, to take risks and to learn and play. And we all have a huge responsibility to make sure that children can be children throughout this COVID pandemic. I want us all to focus on the future, on the positives, and I want us to be absolutely 100% behind each and every child in Newham.
Thanks guys, bye.